Elderberry bottles make it sound like a tiny purple antiviral shield. If someone takes it at the first sniffle, what is the most honest promise we can make? Prevention, faster recovery, or just a maybe?
The honest promise is narrower than the label. Elderberry has been studied mainly as a supplement for symptom experience around respiratory stressors, and reviews find hints of benefit, but not enough consistency to make firm claims. That means we can discuss possible shorter or milder symptoms, but not say it prevents flu, kills viruses in people, or replaces vaccination, testing, antivirals, or medical care.
So, if I am judging it fairly, I should not ask, did I never get sick? I should ask, did my sore throat, congestion, and fatigue resolve sooner than usual? Is that the right scoreboard?
Yes, and the plausibility comes mostly from elderberry's polyphenol, especially anthracene-rich pigments. After digestion, these compounds and metabolites interact with the gut, immune signaling, oxidative stress pathways, and maybe post-meal metabolism. Plausible does not equal proven clinical effect, but explains why researchers look at inflammation markers, microbiota shifts, glucose curves, and symptom diaries rather than expecting one magic antiviral molecule. The problem is not that elderberry is inert. The problem is that the respiratory evidence is patchy. Different extracts, combined products, different populations, and different stressors. A systematic review of immune health supplement ingredients found studies on elderberry, but said the gaps prevent firm statements. A multi-component pediatric real-world study looked promising, yet elderberry was mixed with beta-glucan, zinc, and vitamin D, so you cannot credit the berry alone.
Where does that become dangerous? If someone has real flu symptoms, chest pain, shortness of breath, dehydration, confusion, or a high fever that is not settling, elderberry should not be the plan, right?
Right. And interestingly, the newer elderberry studies are less about colds and more about metabolism. In overweight adults, short elderberry juice interventions have reported changes in microbiota, glucose after a meal challenge, substrate oxidation, and gene expression responses related to insulin, FOXO, and PI3K ACT pathways. Those are intriguing biological signals, but they are small studies, often short, and not weight loss proof.
Who is the most realistic candidate to notice anything? A healthy person with one mild cold a year, someone who travels, someone with recurrent respiratory infections, or an overweight adult curious about metabolic health?
For colds, the best fit person is someone who gets noticeable viral upper respiratory episodes and is willing to track symptoms without expecting immunity. For metabolic research, it is not a consumer recommendation yet. The studies used overweight or obese adults without chronic illness and controlled meal testing. For dry eye, one trial combined lutein, zeaxanthin, and elderberry, so the improvement cannot be assigned to elderberry by itself. For matters, trials have used juices, extracts, and combination supplements, and store products may not match what was tested. A syrup with sugar, a capsule extract, a gummy, and 100% elderberry juice are not interchangeable exposures. If someone tries it, I would choose a standardized commercial product, follow the label, avoid stacking multiple immune formulas, and judge it by a short, specific outcome.
Some videos teach people to find wild elderberry. Is the safety line basically, do not experiment with raw berries, leaves, bark, stems, or homemade concentrated extracts unless you truly know what you are doing?
Yes. Also, people who are pregnant, breastfeeding, immunocompromised, managing autoimmune disease, taking regular medications, preparing for surgery, or giving supplements to children should treat elderberry like a biologically active product and ask a clinician. The risk is usually not dramatic for ordinary prepared products, but uncertainty rises with higher doses, concentrated extracts, multiple ingredients, and medical complexity.
If someone still wants a careful trial, would you make it seasonal and measurable, like choose one product, start only when mild symptoms begin or during a known travel period, and stop if the pattern is unchanged?
Exactly. I would not count one lucky cold. I would track onset date, worst day, fever if present, sleep disruption, missed work or school, and total days until normal function. If the average cold still behaves the same after a few comparable episodes, retire it. If symptoms are clearly shorter, keep the claim modest. It may help your symptom course, not prove immune superiority. The same restraint applies to metabolism. The one-week juice studies are scientifically interesting because they connect anthocyanin exposure to microbiota, post-meal glucose, fat oxidation, and transcriptome flexibility. But they do not show fewer heart attacks, diabetes prevention, cognitive protection, or durable weight change. Biomarkers can guide future trials. They are not the same as clinical outcomes.
So the clean takeaway is, elderberry is a plausible polyphenol-rich food supplement with mixed human evidence, may be useful for tracking symptom duration in some people, interesting for early metabolic research, but not an antiviral treatment, not a raw plan experiment, and not a reason to ignore red flags?